I'm Gord Peckham, the director here at Dartmouth General Hospital.
I'm Dr. Natalie Chang, medical site lead.
And we're standing in our new, big, beautiful space on the 5th floor.
This has been a tremendous effort from the teams. We just wanted to say thank you.
On behalf of the Dartmouth General Hospital, both staff and community, we want to say thank you to the generous donors.
So historically, this space was shelled in the 1980s. So it's been a long time coming, but we now finally have patient rooms built into this area, which we're very excited to use. It's going to make a huge difference for patient care at Dartmouth General.
We're about to open this part of the 5th floor, the 5 West part, and it will serve both surgical and medicine patients. And the staff will be shared amongst both 5 East and 5 West. So we're excited to increase our capacity in support of the central zone and the redevelopment project.
And I'd like to add that these rooms are really beautiful. They're large. There's a lot more private rooms, which will really help towards dealing with our patients that require isolation requirements or palliative care needs. So that's really important. You'll see during the tour we have the mural theme that's continuing on, which is showing the City of Lakes in many of the rooms. We have a isolation room, which is going to help for our patients that have specific infections that require precautions. So there's a lot of fantastic features to this floor, which are going to make a real difference to patient care.
So thank you again for the generous donations and support of our Dartmouth General Hospital.
Hi everyone, my name is Becky Croft and I'm the Health Service Manager here on the soon to be open 5 West at the Dartmouth General. We've been waiting a long time for this and we're ready to give you a sneak peek. Here we are in the unit. The unit has 24 beds, 16 private rooms and 4 semi-private rooms. It was designed to be functional and very well organized. As you can see by looking down the hallway, everything is tucked away in its own little alcove. Here we are at the nursing station. This is where the team gathers together to do their charting and to complete their rounds. The rounds are where all team members come together, nurses, physicians, physio, OT, and other members of the multidisciplinary team to work to create action plans for patients. One of the great features of this space is the big windows that give us all this natural light. Here we are in one of the private rooms on the unit. Each room features brand new furniture, such as this coach that converts into a cot for family members. The beds are all brand new and feature state-of-the-art technology. For example, these beds are able to weigh patients. And finally, every room comes with a lift, which allows nursing and other members of the multidisciplinary team to help get patients up and moving while reducing the risk of injury. Each room features its own hand washing station, an accessible bathroom, and lighting along the floor to help keep patients safe. 5 West features a negative pressure room. This allows for the safe treatment of infectious diseases such as tuberculosis and COVID.
Well, we did it. Thank you very much for your support. Thanks to donors like you, we've been able to complete this Above and Beyond campaign redevelopment for the Dartmouth General Hospital. This 5th floor is amazing. It's a testament to all of your amazing volunteer work, your donations, and the government support. We've made it happen. I hope you've enjoyed this tour of the new 5th floor, 5 West. And we're really impressed as we talk to donors and look at what's happening. Isn't this incredible? It's been over 30 years since the original board had the vision to build a 5th floor, and now it's complete. 30 years later, we're so impressed with what the final result of this redevelopment has delivered. Thanks to donors like you, we've been making this possible, and we're so pleased to see the Above and Beyond campaign come to its fruition. Thank you so much to all the volunteers. This was really in large part to many volunteers who had a vision of what the Dartmouth General Hospital could be and what it continues to grow into. Volunteers like Fraser Conrad, Kim Conrad, the Conrad family, incredible vision for what this could be. Robert Bell, Gwen Halliburton, amazing volunteers on the original board and on our lobster dinner committee. Groups that have really made this happen. Adding the 5th floor back when we did the 3rd and 4th floor was a smart idea and really helped attract the redevelopment to Dartmouth. Thank you so much to the auxiliary for your amazing support and donations and volunteer time to make this a reality as well. I'm sure patients are going to love being on the 5th floor and have a very comfortable and excellent experience here at the Dartmouth General.
Thank you for coming on this tour. We're so happy to finally get to show off this new space. Thank you to all our donors who have made this possible.